Patient and Family Council was created as a way to elicit engagement from our patients. We often in the past have tried to guess. We think our patients want this. We wonder if our patients want that. It feels like they want this. And so creating the council was really a way to get that direct engagement and get that direct feedback instead of guessing.
The group was put together through a very interesting and arduous process in which we solicited applications, and a number of people participated in interviewing many members who were interested in participating and who were really chosen based upon their ability and interest in contributing, willingness to get engaged and to really work as partners with us.
I wanted to give back to the whole Yale Health community. I'm not just talking about the physicians, the nurses, the PAs, clearly speaking of them, but every single person who's there, from the administration to the staff. I know people have bad days, but I've never called to make an appointment and encountered a receptionist who was having a bad day, or at least let me know he or she was having an off day.
I think being part of the council has really given me an inside understanding of how things work, how decisions are made, how thoughtful they are, and how thorough in gathering information and looking over not just results or statistics, but also getting the very human side of it.
I didn't have previous experience on councils like that, so I thought it was kind of neat that we set up ground rules and that the emphasis was on honesty and trust. So everyone there took that seriously, and it really made for a good and honest communication.
And I think one of the great things about it is that people are being very open about how they feel on issues that are very personal or close to them. So there have been discussions where there were different opinions that were being brought up, and not everybody was in agreement, and we were very honest about how we felt. And I feel that that will produce some of the best results because you get to hear both sides of people's thoughts, and decisions are made based on, very honest discussions.
People are not afraid to share candid feedback and constructive criticism and also positive things. And that's really what we want from this group.
Actually talking with real patients, getting their actual responses to things, hearing what their opinions are, helps you to become patient-centered.
I'm used to thinking about what do I want, what are my needs, but I have to think about other people in that process as well.
This feels like a true partnership. We have 14 individuals who sit shoulder to shoulder with us in a room, and it feels, the energy, it just feels incredibly collaborative. And it does feel like, to me, that we are together. We're in it together.
We came to a consensus very early on what we would accept for rules of our interaction, so to speak, and there's a lot of collaboration, a lot of mutual respect. We don't agree on some things, but how that's presented to each other is much, much better than other groups I've been involved with here at Yale and at other places.
Just to be able to hear from the patient's perspective, their expectations and their experiences, it just enriches what I do every day. And I'm reminded of it through my workday now, thinking about those patients.
My deep belief is that everyone at Yale Health has the same goal in mind. We're trying to meet both the physical and the emotional needs of the patients. And at the same time, I hope that we're addressing the physical and the emotional needs of all the staff.
I was really hoping that there would be doctors on the council and people just like myself, an employee, a patient. And so the council is so diverse, and I really, really appreciate that, the diversity of the council.
I guess what's different, too, is just the diversity of the members involved, which is nice to see at all levels. And the fact that everybody is able to input their perspective. And it's interesting that they can be very different, depending, on their background.
The opportunity to work with people who think differently and yet we have a common goal and have mutual respect for one another and each other's opinions.
They offer their opinions based on their background, their experiences, and I feel that they do have a lot to share with us.
Being a part of the council makes me appreciate the other side, the doctors and the staff, and what they have to go through.
I was actually pleasantly surprised how open, each person was, no matter what their background or role was with the health center, whether they're a physician or whether they're a patient. The different types of opinions that were expressed were very open, and I really appreciated that everyone was treated with respect, no matter what their backgrounds were, and that everyone was given an equal voice.
Aspirationally, I would love to see us have patient partners involved in every single aspect of what we do.
Well, I think that this group is going to be increasingly driving agenda, helping us to prioritize the kinds of work that we do in a way that isn't merely patient-focused, in other words, what we think patients would like, but which really is driven by the actual interests of a very thoughtful and engaged group of members.
It's neat. Sorry. I think the patient and family council is really neat. That at a point in my life now, I'm not a young person anymore, and I'm very pleased that I applied and could be a part of that process. It makes me feel good about where I am at Yale, and I hope I make a difference.